Next is going to be investigation for fractures. For investigations for fractures, we need to know that what we have: the investigation for the disease, investigation for the cause, investigation for complication, investigation for background. Generally, fractures are fractures. We have no cause of fractures. For the cause of the fracture, you just have to take it from the history. When the patient is going to give you a good history, we are going to have the cause. So you have no investigation for the cause already. Is it clear? Except the patient is a chronic drinking of alcohol. That is, he has his fractures, or he has his falls, or any problem because of a psychological problem or an alcoholic condition. So you have to manage now the background of the alcohol by asking for investigation for chronic alcoholism, or you manage the background of the psychological abnormality, or if it is epilepsy resulting to the injuries, you have to ask for an EEG in order to manage for the epilepsy. So generally, I just want to say that the cause in fractures or the cause in injuries is less managed. Is it clear? Now, the next thing you have to manage, you have to investigate the fracture. Is it clear? Generally, the investigation of fracture is radiography. Is it clear? That is the major investigation that you have to use in fractures. Is it clear? Every time that you have a bony injury, if you have injuries generally, when you think of bony injuries, your supportive is radiography and your confirmative is CT scan. So the CT scan is best for bony injury. When you have bony injury, the confirmative that there is actually a fracture. If you have only a hairline fracture, you are not conclusive that it's a big fracture, you can just ask again the CT scan to be conclusive. There are certain fractures that cannot be seen on X-ray, like the scaphoid fracture, the lunate fracture may not be seen on the X-ray. It can only be seen on the CT scan. So for supportive, you can say X-ray, which mostly see for big lesions, and then for confirmative, you ask for the CT scan. Is it clear? That is for hard tissue injury. Every time you have a hard tissue injury or a bony injury, you have to ask the X-ray first, and then later on ask for the CT scan to confirm for the lesion. Is it clear? Provided you have not seen the lesion with the X-ray. Now, every time you have soft tissue injuries, when you have soft tissue injuries, you think of any soft tissue injury, you first thing that is supportive, you ask for the ultrasound. Ultrasound is for soft tissue injuries. Example, if you have muscle injuries, you have tendon injuries, you ask first for soft tissue, you ask first for ultrasound, because those are best for soft tissue injury. If you have a joint dislocation, is it clear? You can see the joint dislocation with the X-ray. But if you think that there is joint dislocation with a tear to a ligament, is it clear? Like in the case of a banker tear, is it clear? When you have a shoulder dislocation, when you have a banker tear, or you have a other types of tear, is it clear? So you can ask also ultrasound to visualize tear to these ligament or soft tissues. Is it clear? So when you have a soft tissue injury, you should ask for supportive with ultrasound and confirmative with the MRI. MRI is best for soft tissues. Is it clear? And now when you want to see the physiological function, is it clear? The physiological function of a soft tissue, you best see support. So when you want to visualize, this is to visualize anatomic functions. Is it clear? Now, to visualize physiologic functions of a tissue, is it clear? If it is soft tissue that is having a physiological disorder, is it clear? If you have a soft tissue that has a physiological disorder, a soft tissue having a physiological disorder, you can visualize the functioning of that soft tissue with a Doppler ultrasound. Is it clear? Doppler ultrasound. So when you are doing a cardiac ultrasound, you want to know the functioning of the heart cycle. We use the Doppler aspect of the cardiac ultrasound to visualize the functioning of the heart cycle. That's the soft tissue. When you want to visualize soft tissue functioning, image the soft tissue functioning, you ask for the Doppler ultrasound. And then the best imaging, that's a confirming imaging for the functioning, not for the anatomy, it is going to be a case of a positron emission tomography. Is it clear? So you have a positron emission tomography that is the best for functioning, particularly when you have functioning for malignancy. You ask for positron emission tomography. Now, soft tissue, if you have now hard tissue, you want to visualize the functioning in cases of hard tissues. Is it clear? When you want to visualize function in case of hard tissue, you use instead scintigraphy. Is it clear? Scintigraphy is going to be used in order to visualize the functioning in heart tissue. Or you have also the barium enema or the barium meal, particularly when you use contrast. Generally, when you use contrast, it's just to visualize the functioning. You have contrast material which can be used in anterograde or micturating cystourethropy. You have anterograde pylourethrography. All those, when you use contrast, you are already trying to visualize also functioning of the heart and the soft tissue. I'm talking about heart tissue because when you are placing contrast like that, is in order to enhance the heart tissue characteristics. So all that is going to help you to visualize the functioning. Is it clear? So, and then the positron emission tomography is the best in all. Is it clear? So those are the different elements that you have to know on the evaluation. Now we have other complications. So the patient is having hemorrhage, is bleeding. Is also another early complication that I've forgotten to tell you. Bleeding. Is it clear? So when the patient is bleeding, you need to evaluate him with a HB, an emergency HB, or you just ask for a full blood count, provided that the bleeding is not imminent. You ask also for a blood group and cause match, provided that the bleeding is imminent, and then you want to transfuse the patient. You ask also for a blood group and cause match. So those are the other things you have to ask for the complication. If the patient is bleeding, is it clear? If the patient has bleeding disorder, you can ask for a prothrombin time and the partial thromboplastin time. Is it clear? So those are the different things which can be asked. And now the other investigation that can be asked, we have in a case of, you think of a thromboembolism, you want to support deep venous thrombosis and pulmonary embolism. If you want to support thromboembolism, you ask for D-dimers. And if you want to confirm that there is a deep venous thrombosis, you ask for a Doppler ultrasound of the calf. Is it clear? Ask for a Doppler ultrasound of the calf. And then if you want to confirm a pulmonary embolism, ask for a pulmonary angiography. Is it clear? CT angiography of the chest. Is it clear? Ask for a CT angiography for the chest. All that is going to help you to know that this patient is going to have thromboembolism aspect. Is it clear? Now, fat embolism is just a clinical diagnosis. There is no particular investigation that can help you to know that this is clear-cut fat embolism. Is it clear? Now, those are the investigations that you have to ask in the case of the complications. Now, after asking for the investigation for the complications, you have now to go now to the next part, which are the investigation, provided that you want to operate the patient. You have investigation, pre-operative investigation that you have to ask. Is it clear? Generally, there are certain pre-operative investigation that you have to ask in all patients. So when you want to ask pre-operative investigation, you need to know that pre-operative investigation are divided. I generally divide it into the blood cells investigation and the blood plasma investigation. For the blood cell investigation, you are going to have the first one, which is generally for all the blood cells, which is for full blood count. And then to visualize for the white blood cells, I just say that you have to do the HIV status, because HIV status is going to result in CD4 reduction. Then to visualize for specifically the red blood cells, I say that you have to do also the blood group. Is it clear? Blood group is also another element when you want to do pre-operative management, pre-operative workup. And then to visualize for the thrombocyte, I generally say that you have to do the prothrombin time and the plasma thromboplastin time. Is it clear? And then for the blood plasma, the general investigation that you have to ask, you should ask for the urea creatinine. And then the second element that you have to ask, you should ask also for the blood electrolytes of the patient. So these are the investigation, the general investigation that you should ask for all patients pre-operatively. Is it clear? And then if you now a patient now is going to have specific condition, like a specific medical disease like liver cirrhosis, you have to add now the liver function test. If you have a heart disease, you have to add the heart function test. You have to add the respiratory function test, depending on the failure that the patient has in his past history. Is it clear? So those are the different elements. If he has diabetes, you have to measure the random, the glycated hemoglobin, and the fasting blood sugar level. So after that, we now go to the next point, which is the management of fractures.